Dr. Asti, could you please give a brief introduction on the topic?
Thank you. Thanks, Gabby. Thanks, everyone, for joining today's live stream. Yes, so today we'll be discussing egg collection procedure, which is a part of IVF treatment cycle. So generally, eggs are most important factors which determines outcome of IVF. So generally, egg quantity, egg quality, and the maturation is by far the biggest factor which determines how many high-grade embryos you get, then whether you have successful implantation or not. Because if you get multiple high-grade embryos, then very likely you will get successful implantation. So, and that's determined by how many eggs you produce. The quantity of eggs you produce in each cycle of IVF is very important factor. Generally, we want to get 10-15 total number of eggs per cycle of IVF. So, depending on your egg reserve, it may or may not be achievable, but this is the optimal number to have a good number of high-grade embryos, like 3-4 high-grade embryos. So, and the quantity of eggs are important, and also the maturation of the eggs are also important, and also quality of these eggs are important. So all these things like egg factor, we call egg factors which are egg quantity, quality, maturation, is determined by 5 things. First is your baseline ovarian reserve, your egg reserve. So if you have high egg reserve, your likelihood of getting a lot of healthy eggs is good. If you have low egg reserve, your likelihood of getting a lot of high quality eggs is low. So baseline egg reserve is the first factor which determines the egg factors. Second is a natural variation on the quantity of eggs you have any given time or when you start IVF treatment. Let us say on your day 1, it depends on how many follicles you have and the size of those follicles. Let us say you have average egg reserve, your AMH is 15, your antral follicle is 20. So in certain months you may have more antral follicles, 25, 30 antral follicles. In some months you have less antral follicles. That's called natural variation, and size of those follicles on day 1 of the stimulation. So if you have plenty of follicles ready to go, larger, let us say 7, 8, 9 millimeters, 10 millimeters, then you can have a good number of eggs. So baseline egg reserve and natural variation of your egg reserve. And the third factor is you respond to stimulation, which means how your follicles respond to the drugs. How many follicles go through the activation phase and grow and become bigger than 13, 14 millimeters. So that's called ovarian response to stimulation. So there's a lot of factors determines, including what drugs you use, dose of the drugs. So third factor is the maturation of your eggs. So, and if you have a good size of follicles, if FSH and LH, which is a trigger drug, and stimulation drug is a really matching, and if you have a good maturation, you have plenty of mature eggs. So egg reserve, baseline, and the natural variation, and your response to stimulation, your maturation of your eggs, and the fifth factor is your egg collection procedure, which means whether you had any problems accessing your ovaries, whether your specialist has managed to aspirate all follicles, small and big follicles, to get as many eggs as possible in that given cycle to give a good chance of successful pregnancy. Let us say you may have a good response, good maturation. If your ovary is not accessible, it's very high, or if you're having pain during the egg collection, if your all follicles not aspirated fully, if all follicles not aspirated, you may get a low number of eggs, and a lot of mature eggs might not have been aspirated. So this is why egg collection procedure is also important factor. So 5 factors determine your egg factors in IVF. So one of them is egg collection procedure. This is why we need to understand this egg collection procedure so that we optimize that one as well. So, and the egg collection procedure has got different names. Egg collection. So you see, or OPU, oocyte pickup or egg pickup. So egg collection, we have different names. So essentially, it means same thing. Essentially, aspiration of follicles and get eggs from your ovaries when you do IVF.